Welcome to the JOMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Welcome to the Jewish Orthodox Women's Medical Association, or JOMA, podcast. I'm your host, Elisa Minkin. I am a general pediatrician and proud JOMA member. And today I'm really honored and really excited to be interviewing another proud JOMA member. Again, if you have questions about our podcast, comments, recommendations to make it better, we do appreciate that. Please reach out to us at health, HEALTH, at joma.org. We do want to hear from you. Dr. Donskoy is a pediatric sleep medicine physician at Advocate Children's Hospital in Illinois. She is also a clinical assistant professor at the University of Illinois and Chicago's College of Medicine for Sleep Medicine Fellowship. She completed her pediatric residency at the University of Illinois at Chicago and her sleep medicine fellowship at the McGaw Medical Center at Northwestern University and Ann Roberts H. Lurie Children's Hospital. She sees patients from early infancy to late adolescence and provides an array of services from sleep coaching, sleep health optimization, and treating simple and complex sleep-disordered breathing, movement disorders, circadian rhythm disorders, insomnias, and hypersomnias. And this is part one because we got a lot to talk about. Welcome, Dr. Donskoy. Thank you so much for joining me today.
Oh, my pleasure. Good morning.
So I'm super, super excited to do this with you. I've been waiting a long time. Thank you. Because I feel like as a pediatrician, I talk about sleep almost as often as I talk about eating. And if you look at my podcast, I've done a ton related to that. And so I'm really excited to be tackling sleep with you.
No, it's so important, and we all do it every single day of our lives, right? So it's important to understand why we do it and how.
Yes, and as I'm going to look at it primarily in this episode with the little kids, the babies and little kids, because I find that's where the bulk of what I have to deal with as a pediatrician comes in. It affects the parents' sleep as well.
Absolutely.
So I want to start with talking about sleep in babies. Okay. I find that one of the first questions I'm asked is, should I put my baby on a schedule? And if so, when? And if so, how?
Yeah, it's so hard. We put a lot on young moms. I don't know if I'm young anymore, but I'm a mom of young little kids. So we all feel this tremendous amount of pressure to do everything right, and sleep is really one of them. Take us out of the picture on our own sort of emotional well-being and health. Yeah. And just looking at the baby alone, we hear everywhere, how important sleep is for growth and development. But so the answer to the question is sure. A schedule helps everybody. A schedule will help the family function. A schedule will really help the child. But what we mean by schedule, I think, is really important to sort of, clarify, right? So when we are born, from the moment we're born through those first few weeks, there's a really robust brain development going on of a lot of different factors. My neurology friends can speak to this much more. But one sleep-related factor that's getting developed is the internal circadian rhythm. There's a small part of our brain, it's in the hypothalamus, it's called the suprachiasmatic nucleus, and that is our internal clock, or what we call our central clock. There's actually expression of what we call clock genes or circadian genes in many other parts of the body as well. So, the gut, the skin, they're also responding to time cues and setting us up on a schedule. But that part of the brain that's, referred to as our central clock, that's getting developed very rapidly in this first few weeks. You can look at studies that put like little socks on babies and monitor their movement, through actigraphy. And you can see that very soon they start falling into at least some semblance of a circadian pattern. And what I mean by that is there tends to be a time that they start their day and rise. Yes, of course, infants are still napping and sleeping throughout the day because they can't handle big buildups of sleep pressure. So they nap to sort of pay that off. But then there's also a time at which they tend to start what will be the beginning of a consolidated night. And so this sort of preferred sleep-wake time is what I call their internal rhythm. This is determined by so many things. Genetics plays a factor. So a family of early birds is likely to have a child that is going to fall more easily on an early schedule. A family of night owls, the opposite is true. And it's a combination of nature versus nurture. So there's a genetic component too, but there's also what's happening in the household, right? When are people turning on the lights, starting their day? When is there ambient noise? All of these are important circadian cues that the infant is picking up and saying, wow, this is really the time that activity, bright light, and sound begin. It will start to what we call entrain itself to that being its morning. And the night follows. Really, wake time is the most important thing. When a wake time is set, the rest of the day and then the time we're going to be ready for sleep in the evening are going to follow. So when new moms, I've spoken to new moms when they're pregnant. This is one of my favorite talks to do, and talking about what are we going to do after birth. Well, when you're getting ready to go home with your baby, take a look at your daily schedule. How does your household run? And what you really want is this kid to fit nicely into it, right? Which means that when you are really ready to start your day, that is when lights come on. That is when you guys speak in louder volumes. But when the evening comes for, your child, that's when you want lights dim. That's when you want quieter sounds. That's when you want less activity. And by fostering this light dark cycle, this sound activity cycle, that's the beginning of this schedule. The baby's going to do what it wants in the beginning, but you can start to foster that structure around sleep.
That is fantastic. And I want to get back to sleep pressure. I never heard about it before reading an article that you were interviewed in. I want to get back to it. So let's just hold that for a minute.
Okay.
I want to go back to the newborn period, okay? Because I talk about this all the time with families in my practice. I want to have people understand what's normal because I think expectations are huge. So, what would you say is normal for a brand new newborn baby who has no clue about circadian rhythms?
Yeah, I would love to know the answer to that question too. The way we answer that is with, normative averages that we've collected with population-based data. There's no, scientific experiments being done on, giving infants artificial amounts of sleep time and seeing which one, wins the Nobel Peace Prize in adulthood. We know normative ranges based on collected data. And it's so wide for infants. I mean, less than 10 hours to, 18, 19 hours. There's a huge amount of total sleep time that they might collect throughout the day. So that's really, really challenging. It's challenging on both ends. The mom, who is watching her baby sleep less than maybe other infants she's seeing and wondering if that baby's okay. On the flip side, the mom that's watching her infant sleep so much and needing to wake them just, to feed enough. But the truth is there's a really, really, really big variation on what is normal. I would say what you want to look for is enough rest that between those sleep periods, an infant is feeding enough for good growth and good, urine bowel movement output. I mean, this is like the first few days, right? You want to look for an infant that they're not going to play with you, but is more or less kind of soothable, and not overly irritable between rest periods. That's how you're going to get a feel for, yeah, I think they've gotten, enough rest through these intervals, but it's a tremendous amount of variation.
Right. That is amazing. And I want that to be if the only take home point for today is that there's a wide range of normal, because as a pediatrician, I get asked all the time, how much should my child be sleeping? And it's similar to how much should my child be eating per meal? Those are both questions I really don't like.
Yeah.
But I do think that there's two types of people. There's those that want those numbers, and there's those that can accept that there's a wide range of normal and not to fixate on numbers. But that I think that's a really important take home point, because what if you are focused on X amount of hours and your child's at the lower end?
Right. You don't want to be artificially worried,
Right.
right? And you don't want to be overly stressed because again, that's going to add to our guilt and our cycling and really what kids need, what kids of every age need, but especially infants are, calm and confident moms who know they're doing the best because they are.
Right. I want to go back to the very first few days, because what I was thinking of talking about as an experienced mom and as a pediatrician is you bring the baby home and they're wide awake all night.
They don't know that it's night yet. right?
Right.
They've essentially flown in, from inside you, which was a 24/7 dark environment, dark, quiet environment. And now they're exposed to that light, dark cycling. And they may not know that we live in, I'm in Chicago. They may not know that we're supposed to be on the central time zone quite yet. So this is when you foster that rhythm. This is when we introduce those ideas of bright light whenever morning is for your family, feeds and even naps that are not entirely dark and silent, right? Versus how we treat, the night, even if they're not sleeping yet at night. This is when you talk in hushed voices. This is when you're kind of playing less between feeds and during feeds. This is when you're still keeping it dark. Because even though they're not sleeping on this schedule yet, or rather they're not, living in this time zone yet, you're fostering for them. Think about someone who's landed, from abroad. They are not yet on our schedule. So what do? You foster it for them.
Right. And that is really, really important because I'm thinking of this as sleep learning versus sleep training as opposed to toilet learning versus toilet training. I don't know if
Mhm.
that's a fair analogy.
Sleep in general, it really is a skill. I think we've lost sight of that a lot through these expectations of this is the age, someone sleeps through the night. This is the age that someone drops their nap. Again, all normative ranges too. But we've lost sight of the fact that that's not just going to happen on its own. That's a skill that we need to help our child practice. The same way you're doing tummy time to help them build core, and neck strength, the same way that you're, using light and sound and activity and timing to help them learn when sleep is appropriate.
Right. But you know what I'm thinking now is that it's easy to say that.
Yes, it's
but
hard to do. Yeah,
I
it's
think
hard
the
to
I
do.
think the biggest problem, and I always tell new parents, I say, and this is made up because I don't know if this is true. I said the reason your child is up at night is because what were you doing when you were pregnant? It's dark all the time. You were moving around in the day. You were soothing. You were rocking, 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 and then you stop, and the baby wakes up. I don't know if that's true or not. I just find it experientially to be true,
Yeah,
and I
yeah.
find it reassuring for parents to say this will pass as you teach them. But then the big problem is, it's easy to say sleep when the baby sleeps.
No, not if you have older children and laundry. Absolutely not. No.
Even if not, though, we don't work like that. We've already been trained on a circadian rhythm, and our baby is on the wrong cycle right now.
Right. That's right. That's right. So, I think it does come down to the fact that there really was very little cycling that had to do with the outer world
Right.
when the baby was inside. Right. And so whether that's, I don't know if it's, the baby moved a lot at night. There is data that, in utero babies move more at night or more active at night. I think it's also because we are sleeping and laying so we can notice it more potentially. Well, my OB colleagues will know that more. But yes, right after birth, we need to get them on our cycle, right? And then to come back to the point about sleep pressure, right? So there's two big drivers to how we sleep. One is this rhythm that we've been talking about, right? With this sort of natural tendency to wake and sleep at certain times. But we can't discount the importance of what we call sleep pressure. Right. So the moment a child wakes up, the moment we wake up, any of us, we are building and building and building sleep pressure. We think maybe adenosine, is the marker that kind of
Mm.
rises with that. That's actually why caffeine works so nicely since it's a blocker. But even this little baby, right, as they wake up, they build and build and build sleep pressure, and they can't handle it as well as an older child. And so they will need to nap, right? And what happens when they nap? They slowly pay off the sleep pressure. That's the point of the nap. But they're waking up then refreshed. And so you've got this kiddo that's been napping throughout the day, that's been paying off their sleep pressure. And come the evening, yeah, they're not going to be ready yet for a full consolidated night. That's why most infants don't sleep through the night right immediately at birth because they're paying off their sleep pressure throughout the 24-hour period. You know, I'm not suggesting anyone put their child immediately on the nap schedule either, but you might start noticing times as this infant gets a little bit older where naps consistently happen, and you might try to foster, nap time around those times, especially, leaning towards the first half of the day rather than the second, so that by, midday onwards, maybe they're taking an earlier nap, having more sleep pressure, able to have them actually initiate sleep for the night.
Mm. I think of this as why it's important when your kids get older not to let them nap late in the day.
Yeah, absolutely. It's why
There
it's
was
important
that
for adults
zone,
not to
the
nap.
zone. You're in the
Yeah.
zone, you gotta stay up. But I'm still on the newborns because I think it can be really challenging for parents to know, well, what should I do? When should I start? When should I be concerned about a sleep schedule or trying to help them find their circadian rhythm? What
Yeah.
age would you say that starts?
The setup, the setup for what is night versus day can start on day one. But it's not something that you should expect your infant to fall into in those first few weeks or even like month or two. This is the time that you're getting to know each other. This is the time that you're figuring it out. And really this can last. By about month, like end of month one, month two, you start to see somewhat of a pattern of their naps. And again, I don't think anyone should be worried if the naps are, still every few hours. But I find that tracking, logging, it's one more thing to do.
Mhm.
But if you're tracking feeds and input and output already, sort of tracking when they are consistently sort of falling asleep throughout the day, how long that's lasting for, simply tracking it can sometimes be eye opening and reveal patterns that it doesn't feel like are there when you're experiencing it.
Can you give an example?
Sure. So, you might have a baby that is, napping every few hours and it seems so random and it's all dependent on when you fed her. Um, and then when you start to write it down, you realize that, actually seems every day like around 9 that nap actually starts, right? It seems like we wake up like for 6 or for the day, but it seems like by 9, like, yeah, pretty consistently that nap starts. So you might start to move your day around so that at 9 you're ready for that nap to happen. And you might have, the room set up or wherever the nap is happening. You might plan on it being a little bit quieter, maybe a little bit darker again, trying to keep the rhythm going. But you might try to foster that nap to maybe last a little longer than it would have. Because then maybe as you're writing it down, you're realizing, oh, when I get the 9 o'clock nap to last a little longer, she actually makes it to like 12 or 1 rather than needing a nap at 11 if it's short because, I needed to run out to the grocery store. So I find, I don't ever want to give new moms more things to
Right.
do, but it sometimes creates a little bit of sanity for yourself and helps reveal a pattern you didn't feel was there when you're simply tracking what happens.
Right, but what age would you start this? I don't think it's realistic for a newborn, and I don't think it's practical. I mean, they wake up every 5 seconds, and if you're nursing,
No,
you're
no,
nursing, you might as
no.
well
I
just
would
not
not do
get
this
dressed
till like, right. I wouldn't do this till like the second month.
to the 2nd month, like 2 months old or 1
Yeah.
month old.
Every child is very, very
Right.
different. That's an annoying thing to say, but I'll keep saying it. Yeah.
No, but it's really true because if you're talking about temperament, you may have a child that's super regular and you can see it early on, but we're gonna talk about
Mhm.
children who can be more challenging, and what I'm trying to get to is realistic expectations. I don't want people to leave this talk going, "Oh, by a month old, I should start really paying attention," and so many babies are not so regular
No,
at
no,
that
no, no.
age.
There's never a wrong time to pay attention, I think.
Right.
We're intuitively doing it already, and sometimes I think sometimes it actually helps us. I'm not talking about create a schedule for your child. I'm talking about try to record what is happening as an observer, as an objective observer. What is actually happening day to day? By around month 2, I think you'd be surprised
Mm,
at how much regularity you can find. And that doesn't mean every
wow.
day at 9 sharp the nap happens. It means that you can start to notice, ranges. Um, and I think that actually creates a lot of calm. I think up until that point, if you're just left thinking that everything is random, then that's how you feel inside. It feels very chaotic to think that everything is random. But I find that sometimes tracking it, I'm a big fan of sleep logs almost for every single age, because I often find there's a lot more regularity than we're noticing when we're going, about everything else we need to do.
Right. I'm going to give a push here for parents to get the help they need to get the sleep they need, because it's one thing to do this when you're not sleep deprived. At the 2-month mark, you're still very sleep deprived.
Yeah,
It's asking a
absolutely.
lot unless you're able to get help. So, I mean, like, again, I think this can work early on for some, probably more regular babies, and for others, you may not see a pattern, and it may be an exercise in frustration. And that leads me to put you on the spot for, what do you think about the 12 by 12?
Can you clarify what you mean a little?
There's a book called 12 by 12. There's a whole method of, you've not heard this, of trying to get your baby to sleep 12 hours by 12 weeks old.
Oh my gosh. Well,
You don't
that's a
know that one?
recipe to set up moms for stress and disappointment as well. I mean, everyone's a little bit different, right? Everyone's a little bit different. I think what I like about that idea is that it kind of splits the day in half and just
Mhm.
like day and night. So I
Mhm.
do like that it kind of creates that idea of, what is day and what is night for your child. But again, some are going to have success at 12, what is it, 12 weeks?
Yeah,
Some
by
are going
12
to have
weeks is the
success at
plan.
12 weeks. Um, Honestly, whether or not they did the program also, just
Right.
the temperament of the child and what they're ready, what they're ready for. But for others, right, it may create a lot of feelings of failure, very unnecessarily.
Right. 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 I mean, it's a more rigid program as opposed to yours, which, tries to tune into the child but also provide structure.
Right. And just to be clear, like I don't have a program.
Right.
The idea of just tracking sleep is simply collecting data, the same way as writing down when you did your feeds. Right? It's the same idea. I'm never going to tell anyone to track how often they fed their child to put them on a diet. That's not what we're doing. We're
Right.
just logging it for our own
Right. It's not a
information
sleep
of
diet.
when they last ate, right? When they last ate to kind of anticipate when they might need to eat again. This is the same idea. It's not putting anyone on a structure or a schedule because no two infants are the same. Even in the same family, even twins, born at the same time to this in the same family. It's simply trying to understand your reality.
Right. Your reality meaning yours and your baby's.
Yeah, of
Right.
what's happening.
Right. So now I want to move on to babies that are a little bit older, and maybe they didn't do that and there is no pattern.
Yeah.
And it kind of brings up the question of, well, when can a baby sleep through the night? When can they not need to be fed? And what about the babies that are waking up every 3 hours at, say, 6 months old?
Yeah, yeah. Everyone throws out 6 months. I think that's because there's like published data that potentially sleeping through the night, which is simply sleeping 8 consolidated hours, not necessarily, your night, or the night that you want, is possible. But I think it's only like 75 or 80% of kiddos that do that based on the National Sleep Foundation. So that's important to remember that this is an early time when it's possible. um, it's never too late to sleep train. But sleep training, right, helping a child sleep through the night, it depends on a lot of factors. So if you've got a kiddo who is, kind of consolidating naps nicely throughout the day, who you've tracked and does have a nice, fairly consistent sleep pattern in the day, and you can predict when you're going to have success with falling asleep at night, right? If they've had a late nap, you're not going to time bedtime to be soon after that, right? You understand they've paid off their sleep pressure. You're going to time bedtime appropriately. Sometimes that's maybe even later than you want it to be. And if they've grown well, if they've developed appropriately, if there's no issue with them skipping feeds over the night, it is appropriate to give them a chance to try to fall asleep independently, right? So this idea of sleeping through the night, what does that really mean? It means that a child, an infant, is able to initiate sleep and then cycle through sleep without something external, right? Because in an adult, a sleep cycle, meaning falling into shallow sleep, falling into deep sleep, falling into dream sleep, and kind of tying that all up takes about 90 minutes. In kids, it's shorter. You can have a child with a sleep cycle of 45 minutes. You can have a child with a sleep cycle of 60 minutes. So everyone, again, they're unique. But every time we complete a sleep cycle, right, shallow sleep, deep sleep, dream sleep, we need to initiate sleep. We need to fall asleep all over again. So the baby that you're asking to reinitiate sleep over and over throughout the night, the first thing that we need to do is make sure they know how to initiate sleep on their own,
Right. We
right?
call it self-soothing in pediatrics.
Yeah, absolutely. Self-soothe, but really people focus a lot on what am I going to do in the middle of the night? How am I going to respond if this, infant, my baby is crying? Am I going to go to them? Am I going to not? Right? That's the conversation I hear a lot about sleeping through the night. And the focus really actually needs to be on how that night begins. If
Right.
that baby is able to self-soothe, if they're able to put themselves to sleep without someone holding, rocking, feeding, right? Without
Right.
external help, then this is a baby who's a far likelier to be able to reinitiate sleep on their own throughout the night too and sleep through the night, right? Which is really
Right,
probably
right. It's important to differentiate what your expectations are sleep through the night. But let's put that aside for a minute because another important point I want to underscore is that it is normal to rouse, to come to the level of arousal repeated times in the night. And if you don't have that ability to self-soothe, then you're going to need your mom or your dad or both.
absolutely.
Right. So going back to that ability to put yourself to sleep, what happens that I see is that they stay in the newborn phase of feeding as the last thing they do. And there's nothing you can do differently with a newborn other than feed them. What age would you say, or would this be a gradual procedure to let them self-soothe? What does that look like?
Well, the truth is a lot of times we can feed, right? And feed until an infant is kind of satisfied and full. But maybe arouse them a little bit or not let them fall fully asleep during that feeding. Again, in an infant who's got a temperament that's a little bit easier, this is where a lot of the effort can go, right? Feed them, but not entirely to sleep. This is where the idea of like letting them get drowsy, really drowsy, but stay awake is very, very important because that's going to offer them that opportunity after the feed to sort of disassociate, right? Feeding themselves to sleep. It's going to give them a little chance to actually fall asleep after the feed on their own.
Right. The problem is they get milk drunk.
Yeah.
I never quite understood how that was supposed to work. And I think the younger the baby, the less likely that is to work.
Yeah, it is. That's why you want to feel it out. You want to kind of understand your baby's temperament, and you want to just try, right? Try during low pressure times. The night is there's a lot of pressure on the night, but sometimes with naps, sometimes other sleep opportunities, this might be a chance to simply try and see. Okay, you happy little baby, tongue sticking out, milk drunk, as we say. Put them down and kind of just give them a little rub. Arouse them just a little bit of a drop so that they
Oh,
kind of have to shift.
that just feels so wrong. What's the rule about never waking a sleeping baby?
Yeah, well, I think the goal is important, right? So
Right.
the goal. So the goal in the first few weeks is really survival, right? For a family. And so this isn't something you're maybe trying then, but you're feeling it out. You're seeing what your kid is open to, and if the goal, moves away from let's just get through, these days to let's try to see if he or she, might fall asleep on their own, then this is something that you can try.
That is really important, especially if you think about doing it early. Doing it early, but not expecting it to succeed early.
Yeah.
I think maybe
ex-
that's the right attitude, thinking because what the problem is that parents often just don't realize it happening. And the next thing they know, they have a 6 to 9 month old who doesn't have that ability.
Right. Sleep training, which is what we're talking about, right? This
Right.
this is sleep training. Sleep training is just helping someone learn to fall asleep on their own. That's what
Right.
sleep training
Sleep
is.
learning. I'm going to call it sleep learning
I
because
know because sleep training is so
because
it's
bec- bec- because we're going to now dive into the cry it out
so
tech.
I hate that name. I hate
Yeah.
the name "Cry It Out" because the analogy I always give families, because I inevitably I end up seeing families with a little bit of older infants, right? No one's coming to me the first few weeks.
Right.
Thank goodness. I don't think I'd let them come to my clinic. I
Right.
would
Right.
say, just just survive,
Just
right?
survive.
Get
Yes,
through the
really. And it
next
might take
week.
longer than that first month or two.
Exactly.
I want the expectation out there. Just be nice to yourself.
Yes,
You're
exactly.
not failing if you haven't started sleep teaching.
No, in fact, you're succeeding because
Right.
you're just listening to what your baby needs at this moment. But, the older infant, let's say 1 plus, right, that I'm meeting, and we're talking about sleep training, I myself hate the name "cry it out" and that
Right.
idea. Who wants to just intentionally have their baby cry? Nobody out there, nobody that's, a normal loving parent. Everything that we want to do when we hear a cry is just respond, right? But I think it's important to continue to think about sleep as a skill.
Mm-hmm.
It's not just something that happens one day. It's like your hair growing. It's a skill, right? And as your child is, let's say, between 1 and 2 and cruising, right? And learning to take some independent steps, then my guess is one of the first times they let go of the couch and take an independent step, they're going to fall. They are. They're going to fall the first few times. And you are going to clap and you're going to go, oh my gosh, look at you. You just tried to walk. Everyone come over. You're going to take out the video, right? And what are you going to do? You're going to have them try again, right? And then they're going to try again and they're going to fall. And maybe this time they get spooked and they cry during this fall. And what are you going to do? You're going to give them a big hug and say, I'm so proud of you. Let's try again, right? And what you'll do the next day when someone asks you what you did is you're not going to say, I cried my baby out to teach them how to walk, right? You're not going to say that. You're going to say, I was teaching my baby how to walk. My baby was learning how to walk. It was so exciting. It's this brand new skill that's hard for them. So it's frustrating at first. It's frustrating for me to see it be hard for them. But I know the more we practice, the better they're going to get at. So that is sleep. That is sleep. That's the same idea. It's just a new hard skill. Some skills come easier to some than others, but very few of us get good at something without practicing it, right? And so that's what
Right.
sleep learning is.
Right. I love this, and I'm going to keep using the term sleep learning because I think
Sure.
what we're talking about is instead of a behavioral approach that is the parent trying to control the child, you're trying to let the child learn. It's gentler and it's going to take longer.
Yes.
Okay.
Yes. We have to be ready for that. We have to be ready for that.
Right.
But I think, there's a lot of data on, full, what we call full extinction or cry it out or, just walking out and hardcore sleep training. Honestly, even that is really supported, by the American Academy of
Right, right,
Pediatrics.
right. I find that most parents that I know don't want to do it. And
Right.
if I have my bias, it's not my style. I didn't do it
Yeah.
with my children,
Yeah.
but it does work. But there's a lot of controversy behind it. And I like having a more nuanced approach personally. And my patients, if parents in my practice do it, I don't think they're doing a wrong thing. I don't think they're traumatizing a child for life. I think that's been way too polarized. And by the way, we keep saying this, but sleep is really important for everybody.
Yes. Yes.
So I want to go to a related topic, which is where the child sleeps.
Hmm. So there's really very little, true debate on this. The safest place for a baby to sleep from 0 really to 1 now is, in their own independent space, meaning their own, flat crib or bassinet, depending, how much they can pull themselves up with nothing there at all, no stuffy, no blanket, no pillow, right? And actually in the parental room. So that that piece of it, I think, can make learning to fall asleep in bed
Hmm.
be a little challenging after about 6 months because the child sees you and loves you and wants to be with you, and you're there when they're falling asleep. So that can create a little bit of challenge. Um, what I will sometimes recommend if a family is really wanting to help the child fall asleep without that visual cue of them there, is I'll often bring up the fact that they're probably not going to sleep at the same exact time as that child, and so sort of doing the cuddles and soothes and feeds, but then putting that baby down, drowsy but not awake, not asleep yet, and simply being out of the room until they initiate sleep. That can be a nice first step.
Hmm. Hmm. What about co-sleeping? This comes up for me still.
Yeah.
It's a
I
tough
mean,
one, right?
it is. It is. I think really our priority is safety, right? Our priority is safety. And I know that, in real life, different situations come up, but I think, everything we talked about here is, good consolidated sleep for a child's well-being. So we have to put the well-being first. And really there's no formal safe recommendations for co-sleeping.
Right. And we are pediatricians and we are going to toe that line, not politically, but because we really do believe it. I do have families that do co-sleep and that's what they're going to do. And I try to help them be as safe as possible
Yeah.
because
Yeah.
that's what they've chosen. And I'm going to respect that. I just want to make that clear because this is very controversial and I don't want to be misleading in any way.
Right.
Um, but back to sleeping in the room, I know the AAP originally recommended a year. There was an uproar about that.
I know. I mean, even in my practice also, right?
Right.
Right, absolutely. It's challenging. That's why we try to find ways to at least continue to foster independence around sleep by, at least not being there at sleep onset at the start of the night to try to create some of that independence. But that's a challenging piece.
Right. But I think they brought it down to 6 months. Did they
Okay,
or did we?
officially?
Not a good word.
Yeah. I
Right.
think
Did they change
that
it? I
I
feel like
think
they
there's a
did.
nuance to it. I think I don't have it in front of me, but I think there's a nuance to it. But I think that the formal one is still a year, but maybe I'm wrong. I could be very much
Really? Because I mean, I
wrong.
see a big problem as separation anxiety at that age.
Yeah. Me
Right.
for falling
Meaning,
asleep.
meaning, meaning for falling asleep and the baby sees you.
Right, exactly. That's why you try to stagger when you go to sleep versus when they go to sleep. Because if they've got that ability to initiate sleep without you there, it's going to be less of an issue that you're there throughout the night.
Right, but
Not
it does
all the
add a challenge when they wake up in the middle of the night and they see you. That's
you.
the whole idea of, from these sleep training, plans. Sometimes they require you to come into the room and some children get very upset because they see you and you're not picking them
And you're
up
not responding to them. Right.
the way they want. Right.
Right.
So I want to go a little bit into one issue I see with the co-sleeping, which is these are usually breastfeeding parents and the babies are breastfed all night long. And I really want to dig into this a little bit because there is a philosophy, and again, I try to respect different philosophies. But there is a philosophy of kind of like an attachment parenting style, which it is your job to parent all the time, even in the night, by responding immediately. I'm pushing you.
So, I mean, I think we all agree that we are parents 24/7,
Right,
right? And we are responding to the needs of our children 24/7. But sometimes what the child really needs at that moment is to kind of continue practicing that skill of sleeping independently. So, parents who do not practice attachment parenting are not less parents, and they're not less
right,
responsible for their children in the night. They just have a different plan of what the child needs in the middle of the night and how they'll respond. Um, I think the idea of kind of that attachment parenting. I'm not entirely familiar with all the nuance of that theory, but I think it's a beautiful concept, and I think our generation right now actually really leans beautifully into like feeling a child's need and,
right,
and responding to them. So I think that's an amazing
right,
amazing way we've come.
hmm
I think when it comes to breastfeeding, I am always supportive of a breastfeeding mom. I think it's the optimal way if you're able to feed. I think it's phenomenal as long as they want to. I encourage it, but I think what can happen sometimes is again very simply the child does not never really learns to fall asleep
right,
independent of nursing. Right. And then there's going to come a point in time when you want them to know that and you're just going to ask them to know it when really you haven't ever introduced that concept or practiced that with them. You're handing them an algebra test and saying, do this,
right.
when they've never learned to add. So I don't think that's very fair. And I think, when we are nursing, then maybe just at some point, and again, 6 months I think is a nice mark to do it. If you feel your child is ready, maybe reevaluate at 7, 8, 9 months, right? But if you feel like your child is ready, think about nursing them and cuddling and soothing and then hugging and then trying to put them down or trying to have them fall asleep, without that active nursing going on. And
Right.
that's
And what do you recommend when that same child wakes up at 3 in the morning?
so, again, I think the work, the real work comes with helping them fall asleep at the start of the night.
Right.
As we start working on that, they will still have times that they arouse in the middle of the night because they still have that association. And I like to never tell parents what to do in the middle of the
Right.
night because I'm not
Right.
there with them. I
Right.
always say, like, I'm not going home with you. So whatever makes sense for you and what you have to do the next day and your own sleep, you do in the middle of the night. The work really comes with helping them learn to initiate those sleep cycles independently. That's going to translate into maintaining sleep too.
Right. These are excellent answers. I love your approach so much, but I want to go into it a little bit more because I think there's a really important point embedded in this. You talked about letting your child learn to walk and letting them fall and cry a little bit. And I think one of the problems with responsive parenting, which is a fantastic, applied unintentionally in a wrong way. I don't want to say wrong, but I can't figure out how to express this properly. But a parent who really is having trouble tolerating their child's distress. Let me put it that way. I
Yeah.
think it comes from a misinterpretation of responsive parenting by a parent who has trouble tolerating their child's distress, and they feel that their child should never experience any distress. And
Yeah.
so that's what I think leads to the problem of the perpetual nursing all night, which, by the way, then what I see is behavior problems of the child during the day.
Well, because they're not sleeping well,
Right,
right?
right, right.
That's the thing. The thing to remember about that is that even though it seems like the night is smooth because nobody is making sounds or crying, that child is waking in the middle of the night after every sleep cycle, finding the breast, starting to nurse, nursing, however long that takes, right? And then reinitiating sleep, which means that they're waking up and awake for far longer than maybe they would be, were they able to kind of do that on their own. And that leads to a very unrested child, right? And we kind of talked about this, I don't remember offline or online, but an unrested child, they don't look like an unrested adult, right? They're not getting a coffee. They're not taking a nap. They're not asking for a nap. I can guarantee you. They are really having a hard time controlling their moods, right? Because when we are sleep deprived, any one of us, we sort of lose that connection, that like processing step between our emotions and how we act them out. And so a child who's sleep deprived is irritable and grouchy and acting out. And as they get older, maybe even hyperactive, right? Maybe inattentive. Um, there's a lot of ways this starts to manifest. Those are our clues that maybe we need to change something about the night.
Right. That was a really good definition of overtired. I never understood the term overtired. It never made sense. It sounds oxymoronic, but all parents know that's what they call it. That's what it is.
We all know that.
Yeah.
Everyone who's been a parent, everyone who's taken care of a child, we all know that hot child that skipped that nap, right? We who maybe was supposed to have it. Um, I think as kids get older and they enter the school, we forget that that is what an overtired child looks like. We start giving
Right.
it other names. But absolutely, we all are not our best selves when we don't sleep well.
Right. And that is a perfect segue into sleep issues in children that are neurodivergent. And by that I mean ADHD, autism, and other type categories like that, or even children with temperamental difficulties, because we mentioned earlier, it's wonderful if you have a nice, even-tempered child, right?
Who's got that? I want, yeah.
No, some people do. I see it.
I have one of those too, thank
Yeah, you
God.
get one. You
Trusty
get a
one.
that's
I
that's a
get one.
mercy child. It's a mercy child. Yes. But and neurodivergence is super common. It's considered to be 1 in 5.
Yeah. Yeah.
Right? So it's super
Awesome.
common, and it feels like more because those kids take up more space. And it's bidirectional, by the way, right? Just to put it on, not to put it on parents. Oh, the reason that my child is not sleeping well, and I'm like nursing them still at 3 all night, or they're not sleeping, or they're not in their bed, or whatever. These are often the children that were more challenging to begin with, and not regular to begin with.
Mhm, mhm. Yeah, you can start to notice patterns very early on. And this is also where I'll say that, you know, if you feel like your child isn't fitting the pattern, right? Whether you're an experienced parent, and this is very different than what you've experienced before, or whether you're, talking with friends or even your pediatrician and things are not going that way for you, this is a really good time to ask your healthcare provider if there are pediatric sleep physicians or pediatric
Mm-hmm.
sleep psychologists in your area. I know that not every area has them, but with the pandemic, I think a lot of those providers are doing virtual visits. So there is help and support. And what I would say about any child who's neurodiverse is that I really dislike initially just attributing all their sleep problems to that.
Mm.
Meaning, yes, of course, there's a tremendous amount of data showing that children on the autism spectrum, children with some, ADHD can have difficulty with sleep, initiating and maintaining. But sometimes we have to cross off, the normal stuff first, right? The sleep onset associations, those pieces of it. And that's where a sleep psychologist or a sleep doctor can really, really help, without jumping and simply saying, "Oh, yeah, your kid is having a hard time because they have this diagnosis." Right? That's not a jump that I like to make. It's true that at some point we may end up there, but there's a lot of things to kind of cross off the list first.
Right. And one of those is sleep apnea. And I'm not going to go into it in great detail.
Okay.
And I'm going to say right now that we're getting towards the end of part one. And thank you for offering to come back for part two because we have so much more to discuss,
Yes,
probably three at least, but I'll just ask you for two now.
sure.
But we need to talk about sleep apnea or snoring or
Yeah,
sleep associate, all of those obstructive sleep associated issues, because that
absolutely.
really needs to be attended to. And it's not either or, by the way. All of these things are not either or.
In fact,
I
they're
find that
usually comorbid. Yep.
exactly, exactly. And that's why you have to be careful with somebody who just puts a label of ADHD on your child and look into these things as well. I really do believe that.
Yeah, absolutely. Sometimes, yes, sometimes we don't stay asleep because our brain doesn't feel like it's safe to, right? So if we're not breathing well at night, our brain is going to wake us up as many times as it needs to make sure we're breathing appropriately. Sort of out of the scope of here, but if you've got some kind of restless legs or movement disorder at night, the same thing will apply. We may wake up frequently, and it's important that someone kind of go through your entire history and rule those things out. Um, you know, the one thing I'll say is that snoring is absolutely never normal. It's never normal. Sometimes it's acute because we're congested and then it goes away and then we don't have to do much more. But if you've got chronic snoring more than half the nights, more than 3 months, talk with your pediatrician or talk with a pediatric sleep care provider. There's a lot of different reasons that a child might snore. Sometimes it's, their craniofacial structure. Sometimes it's their
Mm.
adenoids and tonsils. Sometimes it's their weight. But it needs to be investigated. Yeah.
That's a really important point, and I've not heard that because I've heard, they'll go to an ENT, they'll look for enlarged adenoids and tonsils, and if they're not there, they'll say, okay, it's just benign snoring. And you're saying there's no such thing as
There
benign
is no such
snoring.
thing as benign snoring. So we
Wow.
call it primary snoring if in fact it's snoring without upper airway resistance and without sleep apnea. And again, the only way you'll really know that is with a sleep study, because it's very challenging to tell you into a trained eye just observing a child. But the truth is, a long time ago, absolutely, a child snored, they went and got their tonsils and adenoids out, and it was done. And the truth is there's a lot more nuance to obstructive sleep apnea in children. Um, in a certain age group, like that school age, like 2 to 8, yeah, absolutely, it's often enlarged tonsils and adenoids that are leading to the obstruction. Sometimes removing them helps, but as we learned in 2015 with the chat trial, the childhood adenotonsillectomy trial,
Mhm.
sometimes it's not the tonsils and adenoids. Sometimes they don't get better after adenotonsillectomy. Sometimes it's because of weight. Sometimes it's because of syndromic status. Sometimes they've just changed the shape of their face with their
Right.
chronic mouth breathing. And so you just really want a team thinking critically about what's happening with this child and importantly, why? Why is this happening?
Wow, that's really important, and I did not hear that exact same perspective from ENTs, so I'm gonna remember that.
Yeah.
That would really be a lot of sleep studies, though, because snoring is not uncommon in children.
Right. So the AAP it has a nice set of criteria. It's actually from an over 10-year-old paper. It's from the 2012 position paper on obstructive sleep disorder breathing in children. And they really have a nice, they acknowledge, 20% of kids snore, 2 to 4% have sleep apnea. So it's to study every snorer is not only unfeasible, it's gonna be low yield as well. So they really have a list of sort of what I call like snoring plus one criteria. There's a nice little table in that paper that just breaks down snoring, plus one of these additional findings. Some of those are witnessed apneas, some of those are ADHD and learning problems, some of those are bedwetting, right? So snoring plus one of any of that list leads to a high positive predictive value for having significant sleep disordered breathing or sleep apnea on a study, and those kids really warrant the study.
So you're saying snoring is not normal, but it's very common and you should look further, but it doesn't mean that every child who snores needs a sleep study because that's a big deal, especially for
It's
a
a big
little
deal.
kid.
Oh, yes, it's not fun to do, nor
Yeah.
school. But yes, if your child has snoring and any, additional challenge, then it's worth thinking about if this is actually kind of under a bigger umbrella of them having a hard time breathing in their sleep.
Wow. Can you send me that link? I want to add it to the show notes. I want to
Yeah,
read it, but I
absolutely,
think that's
absolutely.
really important, especially for clinicians to know.
Yeah.
And I'm going to use this moment to stop.
Okay.
We had twice as much things I wanted to cover, and it was way too much. And
I'm so
so I want to
sorry.
thank you for agreeing to do part 2 with me.
My pleasure. Yeah, I'll be
And
happy to do
thank
that.
you so much for doing this with me. I really appreciate it.
No, it was my pleasure, and I'll send you that link. I'll send you that link later today.
Yes, I'm going to put it in the show notes. Be well and have a good Shabbos.
Okay, good Shabbos.
Thanks for listening to the JOMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at JOMA_org. Check out our website, www.joma.org, that's JOWMA.org, or email us at health@joma.org.